Hello, my name is Vyacheslav Semenikin. I am the CEO of Palmira Biopharma, which develops modern biopharmaceutical proteins for the treatment of critical diseases. Today we'll tell you about one of the drugs. This drug is under the working name angiogenosept and stimulates the growth of microvessels for the treatment of ischemic conditions. What are these diseases? First of all, we are talking about a heart attack, the first cause of death for a human. Here it is. Then we talk about such a serious illness as a stroke. After some types of strokes, patients need urgent stimulation of the growth of microvessels in the brain to reduce the damage. And of course, we are talking about the treatment of ischemic conditions such as limb ischemia in a broad sense. The fact is that today humanity does not have drugs that would stimulate the growth of microvessels to prevent further complications. Our team consists of well-established people. It includes 4 PhDs, MD, and researchers with good international experience. It is important to note that the founder of our company was Ivan Lobov, a man who is not only a wonderful scientist, but also the developer and author of one of the well-known leading drugs. This is an Eylea drug, highlighted in red. This is a drug that sold for $9 billion last year. In terms of publications and scientific citations, our team publishes in such publications as Science, Nature and other famous and highly cited scientific journals. How do we create this class of drugs? Let's take our protein as an example. So we take the human receptor, for example, DLL4 as in our case. Here it is. Then we take a human antibody. In this case IgG. From the humanity of the receptor, we take the outer extracellular part of the receptor. From immunoglobulin we take the Fc domain. Then, using genetic engineering methods, we construct a new hybrid protein molecule, which is our target protein. It contains the extracellular DLL4 and the IgG Fc domain, which allows, on the one hand, to effectively interact with the Notch signaling pathway, blocking it. And on the other hand, they have part of the immunoglobulin. To be less invisible to the body's immune system, and thus prolong the life of the therapeutic protein in the human bloodstream. Above you see an approximate 3D model of our protein. After we have formed the idea of the final molecule, we make plasmids. Then we make cell lines. We produce therapeutic protein on them. And we show its properties in cell models. Then we apply for patents. Above you see the formula of our plasmid. And below a series of experiments that show the therapeutic properties of the protein produced already on the basis of permanent cell lines. If we talk about patents, then we have a patent that fixed the foundations of technology. Last year we filed 2 more patent applications, including through patent cooperation treaty. These applications just describe the invention that we are talking about today. It is very pleasant that last year we received first place at the Moscow Innovator Competition in the nomination Project of the Future, in the direction of medicine and pharmaceuticals. This award was organized jointly by the Moscow Innovation Cluster and the Moscow Innovation Agency. This is a very good assessment for us. The year before last, we became nominees and received second place in the Patents Power competition. The competition held jointly by the Skolkovo Foundation and the pharmaceutical company Bayer, with the support of the International Agency for the Protection of Intellectual Property. We were very pleased that we got the second place out of 736 startups. This highlights our capacity to protect intellectual property. We are quite active in the public space. From a business point of view, the drug market is more than $1.5 trillion. The target niche that we are targeting is $12 billion. In terms of competition, we currently have only one drug that can be called a competitor in our class. This is Neovasculgen. This is a supercoiled plasmid which, after injection, should lead to the creation of proteins that stimulate angiogenesis inside the patient's body. Of course, we understand that our offer looks more interesting because we produce a ready-made therapeutic protein in fixed doses with a clear effect. Thus, we see many advantages in relation to the current competitor. From the point of view of business indicators, I would like to draw your attention to the fact that with the expected valuation of our company by 2030 in the amount of €139 million, this is a pessimistic estimate for limited markets. We need 10 million euros for a 45% stake in the company. What will the investor get? Together with the 45% received, he will receive an expected rate of return of 30% per annum and an expected return on investment of 50%. Where will the money go? The graph shows the distribution of tranches by year until 2027. We see in this graph that the main part will be spent on protein refinement and clinical trials. And so, today we talked about our idea of a drug for the treatment of ischemic conditions. Diseases such as heart attack, stroke, critical limb ischemia, diabetic foot. I draw your attention to the fact that in our website you will see that in our portfolio there are ideas for the treatment of other critical diseases. Now we are looking at our site. We're talking about the fact that we have drug ideas for colorectal cancer. There is an idea for a drug that will fight rheumatoid arthritis. And there is the idea of a drug that is intended to treat certain diseases of the eye. An example is wet macular degeneration. On our website you can see the features of the TRAP method, a description of our team, as well as some interesting material on the topic of biopharmaceutical production and the features of our findings. I will be glad if you visit our site. I will be glad if you call me or leave your contacts. We will be very happy if you support our project in one way or another. Thank you.